Dr. Aronowitz, you mentioned something when we were in a little break here. You mentioned something about second opinions. That was a little bit more second opinions. You know, what and how and why should one get one, and what should one pay attention to if he ever even gets a second opinion?
Well, Helmut, now you're talking about something that really is interesting to me. People don't quite understand that the philosophy.
You mean sorry to interrupt you, but whatever we said so far wasn't interesting.
This is especially interesting.
Well, all right.
To me.
All right.
People don't understand. They figure that if they go to an orthodontist, they can use braces, and it's the same whether you go to orthodontist A or orthodontist B or orthodontist C, and that's actually not accurate. Different orthodontists are trained in different ways, and different training programs. My training program, where I was trained and where I'm actually a professor at right now, is the University of Southern California School of Dentistry, has a certain type of philosophy which is different than other places. And then even after you graduate learning that philosophy, you're still encouraged to kind of branch out on your own and do things with your own bend to it, so that it's actually quite rare to see two different orthodontists doing exactly the same thing. I have a group of orthodontists that I study with every month or so. We come together in the evening in one of our offices, and these are all very, very fine orthodontists in the city of Los Angeles and Beverly Hills. And we pass around the x-rays and the photographs and the models, and everybody says something different. They all probably would make it work, but some of them the treatment is going to take longer, or some of them use heavier duty braces, and some of the results might vary in one aspect or another. So it behooves every patient and every parent to get one or two different opinions and to understand what the differences are, and match their treatment to the doctor that kind of has the similar philosophy that they have.
So because one shed some light on this next question here. It doesn't matter how highly educated a patient is. Maybe he's a rocket science, maybe he's a psychiatrist, maybe he's an engineer, maybe he's an entrepreneur and is the chief and inventor of Google. Very smart people, very successful people. But if you get 6 orthodontists together and they kind of have different ways of doing it, well, none of us ever learned orthodontist. And I have had normal dentists telling me that whether the guy's an MD or a cardiologist, it wouldn't matter. When he comes to that dental chair, he is like all of us, scared and uninformed. Now, obviously that must be there. So how can a patient make up their mind? Let's just compare it with politicians. You listen to one guy and you go, oh, that makes sense. You listen to the other guy, you go, oh, that makes sense. If you don't really dig into yourself, you really have no backbone. How would you suggest a patient should go about there to, when he gets 2 opinions, rather than being now confused? Because as you said, all orthodontists in the end will go there and will straighten out their teeth, and the patient wouldn't necessarily be able to say, this is better than this is better, because he's not educated. Shed some light on that.
Well, there are a few questions that should be asked by any potential patient of any orthodontist right from the beginning.
Okay.
And one question is quite simple, and that is, Doctor, how many patients do you see during the day? And Helmut, you'll be surprised that in some orthodontic offices, a single orthodontist can see 100 or more patients in a day. And if you divide that an 8-hour day by 100, you'll see that the orthodontist doesn't have quite very many minutes to spend with any particular patient.
5 minutes.
So it's good math. So it's important to each time you see the patient to see what's going on with the patient, how they've experienced was the wires too tight, was the Invisalign too aggressive, to see how the appliance is going, to see how the patient's responding to it, and to see if something is going on in the patient's life that might require slowing down or speeding up or getting a break. And in 5 minutes, you just don't have that time. So that's a very, very easy question to ask. The other question
it could of course be, I mean, just to say, it could have been that the guy says, well, I see 10 patients, and that is because basically, I don't know, he just doesn't have a lots of business. Maybe he's not a good businessman. Maybe nobody wants to be with him because he has problems. So, I mean, again, how does the there are many other factors involved, even if a doctor sees very few patients.
Well, Helmut, then the question really is, if they see very, very few patients, you might want to ask why. But even if whatever the reason is, they still have more time for each patient to see what's going on. Mm-hmm. If they see very, very many patients, there's no question that they just don't have the time.
Got it.
And everybody likes to have a little time with the doctor, not the employees, to explain what they're seeing and what's going right and what's going wrong. And once you sign up, you'll be disappointed.
Right, and that's actually not just with orthodontists or with dentists, but in the MD field, you know, the absolute biggest problem with the invention of HMO and stuff like that, where the doctor gets less money and then name it, and he has to see lots of patients to even, you know, have a chance of making a living, and gets dictated. There's nothing more patients complain about than the doctor isn't listening. I open my mouth, I say 2 sentences, it takes me 4 seconds, and he apparently now knows everything about me. You know, patients want to talk about their thing, whatever that is, even though maybe clinically it doesn't have always a relevance. But if the patient can't voice what it is all about, he feels like, I don't think I'm getting what I'm supposed. He might get what he's supposed to get clinically, but he doesn't get it in terms of feeling. And I remember a doctor, coming to when I was a kid, and they still made house calls then, and back in Austria. And as long as the doctor somewhere on the way in and on the way out and in between would be sitting there chatting with mom a couple minutes, not about me, but about I don't know what else, and putting a hand on his shoulder and says, Helmut, by the time you get married, it will all be okay. I felt like I'm fine. I mean, it wasn't the, take this pill and do this thing which did it. It was the easygoing talking which did it, and I'm sure that that's still important. So yeah, I get it. Sorry for interrupting you so long.
Well, Helmut, we're losing that doctor-patient relationship where you get to spend a little time with the patient. And if you're going to a brain surgeon, you don't really care if he knows how to chit-chat with you. You just want him to know what he's doing with your brain. But with orthodontics, it's very unique in that the patient actually goes out after he leaves your office and does most of the homework himself. So whether it's wearing the aligners, changing the aligners, wearing rubber bands, cleaning their teeth properly, they have to be inspired by the doctor to do what's right and have to be appreciated for doing that. It's kind of like a coach getting his team out on the field and making sure they're giving 100%. If the patient doesn't give 100%, they're not going to get the results that they need. So somebody has to find out what's going on with the patient and make sure that they see the progress and they're not getting discouraged, and they're motivated to go out and do the right thing.
I think
so that discussion that you had with your doctor as a child is very, very important, and is still very, very important in orthodontics.
No, I can see that. You touched on something very, very, I think it's a good example, a good analogy, and that is, the coach. I mean, obviously a coach needs to know how to play, needs to have a gameplay, but any movie we watch about a team coming out of the nowhere or back from the nowhere, the thing which made the coach and the team famous is basically the speeches that like in between the play speech, the pep talk they're getting, because that's how we do things. And frankly, being 58 years old, I mean, my wife's pep talk is worth a lot more than me reading material about my profession, which is needed, but really to put the fire below, it's that pep talk from my wife.
Helmut, of course you're right, but you missed one thing. It's not just giving them the pep talk, but listening to what's going on with the patient.
Yeah, absolutely.
If your star player has just undergone a tragedy in his family, he's not going to be concentrating on what he needs to do, and you need to know, the coach needs to know that.
Right.
And when I'm working with the patients and a child is getting moved around from the mother's house to the father's house, and there's no coordination with their toothbrushing and their cooperation with the rubber bands, I need to know what's going on, and you can't find that out in 5 minutes, Helmut. You have to be able to chit-chat a little bit, both with the child and with the parents, and find out what the issues are and find out how to get to the bottom of it. It's not so automatic that you put braces on and the teeth will miraculously straighten. You have to really understand your patient and work with what's going on in their lives.
Right, because they have different circumstances. They even eat different types of foods, different type of ways, and, school problems and school situations, not necessarily problems, just situations, whatever they may be, having to go to piano lesson right after school, having to do this, having to do that, blah, blah, blah. I get that. So would you say that is one of the big part of a second opinion is when people come to you and they had the braces examined by someone else, is that kind of what you do? You really find out what their lifestyle is, and by doing so be able to match what fits them better and getting them excited about doing it rather than just clinically telling them what's going on.
Yes, you and your child need to like the person that's working on your teeth. If you don't like them, you're not going to want to impress them, and you're not going to want to seek favor in their eyes. So that you have to, when you're bringing your child to the orthodontist, if the orthodontist is not friendly and not engaging the child, then you know that orthodontist is not going to be inspiring and encouraging your child later on. So it pays to meet 2 or 3 orthodontists and to see which one your child relates to better.
Wonderful. Because it is, after all, a long time thing. It's not like with a veneer where you go in, 30 minutes later you're out, and it's fine. This is a long-term thing, and the child or the adult needs to be, pushed to do the right thing on a continuous basis. Now, tell me something else. So, anything else, like are there maybe any measurements, any type of new X-rays or imaging which you do take when you do that second opinion, which sometimes some other orthodontists might not take?
The technology aspect is pretty universal. Most orthodontists are taking advantages of all the technology. Mm-hmm. Some orthodontists go too far with technology, and they rely too much on technology. They have all these computers and everything, and they lose the human touch and the actual discussions that we just talked about. But most orthodontists are very much up on all the modern techniques and all the modern type of imaging. So that's usually not a problem. But one thing that is important for parents of especially young children to understand is that orthodontists differ about what age that they should start a patient. As I told you, some orthodontic problems get better as a child grows, and some get worse. And you need to go to an orthodontist who's not going to necessarily put appliances on every child that walks in the door, but who is able to discern the difference between those who need treatment right away and the majority of patients that can just be observed and postponed until the right time. The better you can pinpoint the right time to start, the shorter the actual treatment and the less chance that the child will be burned out by the treatment itself.
Beautiful. Thank you very much